I'm just going to give everyone an update because I want to do this for 5 minutes. And I feel as if the presentation is very similar to what Dr. Partha was sharing. So just very quickly, ROSE is a solution that uses self-sampling, digital technology, and HPV testing that was developed between our friends in Australia and using localized knowledge in Malaysia. Very quickly. So you walk into a health facility. This was the original ROSE. You walk into a health facility, you register on a mobile phone, you get a message on your mobile phone, which then validates your phone number, to which then the nurse will then teach you how to perform a self-sample. You have a self-sample done, it's processed, and you get a result through your mobile phone. So the original program was used to train nurses in the health facilities, but then later on we found that we could go to the community and use the exact same training program to teach local champions to reach out to local women in their different communities. And it was really powerful because pre-COVID times, we could do up to 200 screens in an hour. That was how easy it was, and the limiting factor was were the number of mobile phones with connectivity in rural areas. So we use the WHO self-care intervention, and we said that this is something that is proven to work. It's not research, and it could be used in the community. And very much we were pushing this as a self-care intervention. So came COVID, we had lots of challenges, all of which were mentioned, but we felt that there was also an opportunity to flip these challenges into opportunities. So we very much encourage the shift of screening from the community, from the healthcare centers and hospitals to the community. We use digital technology, and people became more comfortable with it, because certainly for COVID, we used that for contact tracing in Malaysia, and so the population, the society became very comfortable with using their mobile phones. And the discussion around molecular laboratory capacity was also simpler because the capacity increased. And really the conversations around self-testing became easy. We went so much, the agility was there, and so much so that we could even train the volunteers to perform screening in their community using Zoom. After the training, we would drop off about 100 swabs. They would do the screening among themselves, and then we would bring it back to the lab. So we really didn't have to get these women into the hospitals. We got the swabs out to the community. And when the schools were closed, we had what we call a standard operating procedure compliance screening programs, where we use school halls and we use community centers. And one of the really nice programs we did, and we started during the COVID period, was called Frontliners United Against Cervical Cancer. This was where we encouraged women, armed force officers, police officers, to look after themselves while they look after the community. And it was really a big hit. And with that, we reached quite a number of these, what we call frontliners. And there's a really nice story to this. Down at the bottom right corner, you see the head of corporate communications of the Royal Malaysian Police. I'll tell you a bit more about her later on. So colposcopy carried on in Malaysia, as you saw in the slides which Dr. Partha Basu showed. Colposcopy services carried on in Malaysia despite COVID. So coming back to Dato' Asmawati, she retired last year as the corporate communications police officer. And since then, she became an advocate for cervical cancer screening. She has become a ROSE ambassador. I mean, this is really a nice story of empowering women down up, and she's pushing the agenda of cervical screening, even though she's not a frontliner anymore. So some of you may have seen this. UICC and the Economist gave us the opportunity to talk about how we originally funded pilot rows. Funding is challenging and grants sometimes are quite difficult to obtain during these times. And so we use crowdfunding, and it's described how the original pilot was funded. And now, as an update, we are looking at this more carefully. This is just an overall picture. It's complicated, but it's to show you that the Malaysian healthcare system has a Ministry of Health arm, has a hospital for armed forces, the Ministry of Education, to which the university falls under. We have our own hospitals. So while we all work together, we are still in different silos in terms of our healthcare structure. And over the right here, you see the entire private sector. And in terms of funding of the different of the screening and treatment, we are also trying to understand now who pays for what. Therefore, Program Rose is trying to see how we can reach and how we can educate the different subsections of the healthcare system in Malaysia. The Ministry of Health has already taken the view that they will do self-sampling, HPV testing and screening. That's not an issue anymore. But how do we fill up the other pockets? And that's where we are coming in to fill the gaps so that we can accelerate cervical screening. So if you look at this graph, you can see that there's a physical channel, there's a virtual channel, there's what they call a premium service and a mass service. And what Rose is now doing is trying to see how we can get into these 4 boxes here. And we're engaging with health economists, and this is where local knowledge becomes extremely important in how we reach these different groups. And this is my last slide because it really tells a story. Last week, we had a renewed funding from a corporate bank to give away free screenings to 6,000 women. Here you see, I was talking about using self-swab for cervical screening, and right in the middle here is the president of the International AIDS Society, and she was leading the COVID task force. And here she shared the story in public of how when COVID started, we ran out of flock swabs and how they had to use these swabs for the nasopharyngeal COVID testing. And it was hilarious because we said this is where public health requires public measures and quick thinking. And what I like about this slide is you see an army officer and a corporate person taking a photo together. I think these pictures paint 1,000 words as to what we can do in a country like Malaysia. Thank you very much.